we look at the last couple of decades, firstly, there's been a big push around policy, around drinking, around alcohol, as though it's some kind of uh, evil or social nastiness. We never hear about entertainment without hearing about alcohol related crimes, alcohol related harms. Very seldom do people talk about thousands of years of celebration, people engaging with it, with all sorts of great moments in history for themselves to commemorate them. And for the majority of people, it's something that's very enjoyable and people do responsibly. But the discourse around it has become one that reflects our view of people, which is that people are out of control. Uh, they're like constantly consuming, they're toxic, they need to be regulated, they're vulnerable, they know not what they do. We need to instruct them. And part of that has taken the form of being a public health series of campaigns that is talking always constantly about units and health and impacts, as though our ability to make judgments and decisions, and sometimes maybe drink a little too much and then at other times not drink, but the decisions with consequences that adults can make, but always needing now, it seems, to be nudged or instructed or pushed. And we've seen that in terms of control around licensing premises and the public outdoors and discussions around venues. We've also seen it, of course, in a range of areas in terms of flying, but now we see the driving discussion. And as you say, there's very, very limited examples of, at this lower level, the impacts of that. There's quite extensive evidence, of course, of people if they're drinking bigger units. The question is also, why now and why cars? I mean, this is in the broader context, not only about the discussion about the health and the idea that the state, rather than building hospitals and having great provision and getting an efficient NHS that's really good and efficient with helping frontline workers and getting rid of all the bureaucracy. And the idea is that they tell us what to drink and eat more and more. Now, the thing about the driving as well is that we know that there's been a war on cars, there's been an assault on movement and people. So in a way, in the context of all of this, it's another one of those things that kind of corrodes and etches away our abilities to have some freedom and judgment and decision making. Increasingly, the idea is that we'll have a third party, a management style organization that will tell us what to do, how to do it around these very, very specific terms. One other thing, finally, is that, you know, the thing about the units and numbers is we know people are different as well. Some people, after a couple of drinks, get really impacted, and others can drink much more. Now, I know you have to have a measure, so that's fine, you do that, but there is no real compelling need and argument for this.